Good morning, everyone. Today I'm going to present a stent fracture during ostial RCA stenting in a case of Takayasu arthritis. So my patient is a 38-year-old female. She's a known case of Takayasu arthritis. She had a past history of right-sided hemiparesis and she had bilateral carotid and subclavian stenosis. She was advised for grafting, bypass for this, but she hadn't undertaken the procedure yet. She was already on methotrexate and maintenance dose of steroids as well as antiplatelets. She had complaints of chest pain on exertion, which was radiating to the left arm for the last 2 to 3 months, and it got aggravated for 1 week. So she came with unstable angina, ECG showing ST depressions in inferior and lateral leads. She was admitted for coronary angiography. On doing the angiography, the left main stem was normal. There was mild ostial disease, sorry. The LAD and LCX was okay, but there was 90% stenosis of the ostial RCA. This is the angiogram of the right side, where we can see the stenosis. There was wedging of the pressure, so we had to do it like this. So we went for the angioplasty. We used a Whisper wire. The lesion was pre-dilated using a 2.5 into 12 mm semi-compliant balloon. We used a 4 into 18 mm sirolimus eluting stent, and it was deployed in the ostial RCA at 11 atmospheres, which was the nominal pressure of that stent. Then we did the post-dilatation of the stent using a 4 into 12 non-compliant balloon at 12 atmospheres. So when we did the stent boost, we saw the stent fracture in the ostium of the RCA. Is it visible? So we deployed a second 4 into 18 mm stent, sirolimus eluting stent across the first stent, and it was post-dilated with a 4.5 into 12 mm NC balloon. This is the final result and the final stent boost image. Currently, the patient is doing well at more than 6 months of follow-up. And as we can see in a seemingly simple case, unexpected complications can occur. Stent fractures can sometimes occur on deploying stents at very high pressures or on excessive post-dilatation. But in this case, the stent fracture occurred even though the stent was deployed at nominal pressure and without overly post-dilating the stent. So whether the underlying iotoarthritis had a role to play in this fracture or whatever is still unknown. We didn't have any other imaging available for this. So we put in a new stent, post-dilated, and currently the patient is doing well.
Thank you very much, Varsha. That was a very beautiful case, well demonstrated. In fact, in olden days, we were not putting the stents for the ostial stenosis, especially for Takayasu, because it has more of fibrosis compared to other. When you compare with the myocardial bridge and this, what is the difference between stent fracture? The Takayasu's versus myocardial bridge. In both conditions, you get the stent fracture. What's the difference?
Sir, ma'am, in Takayasu, it occurs earlier as compared
As soon as you are putting, that time it fractures because it's fibrous and it doesn't yield. So you are using force to open up the stent and the fibrous tissue is not allowing. So it is like a tug of war between the two anatomies.
In fact, there was a case published of subclavian stenosis in Takayasu. Yes. There was spontaneous stent fracture multiple times. So they had put in a stent twice and all those things.
Yeah, that's why we were sending them for the surgical. They would open up and put a venous patch and then open it up,
Also, in RCA, it's known to have more of stent fractures because of the motion of the vessel. The cardiac motion is excessive.
Yes.
The hinge angle is more.
Correct.
So more chances of stent fracture here.
Myocardial bridge, the stent fractures over a period because of the shearing effect.
But here it happened immediately.
Yeah, that is because of the fibrosis. So that's why whenever you see an ostial stenosis, it is mandatory for you to rule out the other conditions. In your case, it was not difficult because she already had paralysis and everything, it was well. But when the patients come with heart failure or with the ostial stenosis, please look for the iotoarthritis, especially in the young women. That's a message from your case. Yeah.
Thank you so much, Dr. Varsha. It was a great presentation. One question, have you checked the ESR status, CRP status?
At the
What
time
was
of
it?
presentation, when we started her on treatment on methotrexate and steroids, that time it was 135. Right now it's around 20 to 25.
So
She's
before
doing-
stenting, it is very mandatory to check your levels. Unless it is an emergency, you need not go ahead with the stenting unless the patient is in cardiogenic shock.
She was in remission at that time.
She
This
was in remission.
Yes.
Then why did you go in for a drug-eluting stent rather for a BMS in such patients? What is the role of bimetal stents in such patients?
Ma'am, as such, BMS is not so much available on our
Available,
shelf.
okay.
So that is
Since
a
it-
practical problem. We had contemplated putting in a BMS, but we didn't get the right size, and also eventually we settled for what is available.
Okay. Have you gone through the article about by Dr. George Joseph, a state-of-art review in Takayasu arthritis, published in by American Heart Association? It's a wonderful article. So it has got a lot of learning points when to stent in Takayasu arthritis, as ma'am said,
Ideally,
the
surgery would have
fibrosis.
been a better option, but being a young female, she hasn't even undergone the surgery for the carotids and the subclavian for, it's been more than 2 years. So she didn't agree.
So what did you do for the carotid and subclavian?
She's still on treatment. She's not agreeing because the surgeon also agreed, but she's not still ready. She doesn't want to undergo surgery. In fact, she had quit treatment for about 3-4 months in the middle of, then she worsened and all these things happened.
Dr. Varsha, do you think cutting balloon is an option in such
Yeah.
situations?
Yes.
A highly fibrotic
Yes,
osteal
that
lesion.
was what we
No,
thought.
that is the first thing
Maybe
that you
that
should
would
have
have
thought of.
prevented the stent
Yes, I
fracture.
think the optimization might not have been, yeah,
Yeah, because if we had to use the cutting balloon, the stent would not have fractured.
maybe.
What do you think is the risk of restenosis in her?
I think there is a fairly high risk.
Very high.
I think
2 stents. Stenting itself
one
is one
inside the
this
other,
thing, yeah.
and plus she had.
There was no other go. You had to use the second stent.
Thank you, Dr.